Our next speaker is also a friend that we've worked with before. We've worked on other issues um, with Senator Pat Colbeck from Michigan, and he's going to bring to us some of the efforts that are happening in the great state of Michigan. He's a senator from District 7. Patrick?
Oh, it's so good to be out here with a bunch of freedom fighters here. Thank you very much.
Thanks for being here.
I've seen a lot of folks on not just healthcare topics around here, but also Jim. I was just on a panel with on campus free speech. Was it last week or 2 weeks ago? Yeah, it's all blending together. So it's truly an honor to talk about something near and dear to all of us, especially my family right now. Is my mother-in-law just went through open heart surgery, and we got a firsthand exposure to the impact of certificate of need laws, because when she did all of her prep, she's got AFib, so she's on Coumadin, so there's a little bit of prep that goes into that surgery. She gets there, wakes up at 4 o'clock in the morning, get to the hospital for surgery at 7 o'clock in the morning, and then at around 9 o'clock they said, we don't know if we're going to be able to do your surgery today. We don't have enough beds in ICU to go off and accommodate you after the surgery. And sure enough, that was touch and go throughout the day, and they just did not have the capacity to go off and take care of her. So for me, this is near and dear to my heart. So is there a presentation loaded here on this? Just, okie doke. That's not the slide that I thought I had. But while we're doing that, I can't help it. I'm a recovering management consultant, so I have to think in PowerPoint. And I also have to address my good colleague here from Georgia when I'm talking about Georgia versus Michigan, because the first slide's kind of telling as far as where we stand on CON laws in the different states here.
There you go.
No, not that one. It's a little north. They have somewhat of the same weather we do. It's DC, CON. Okay. I got it right here. All right, well, as it's going forward, we're going to get into this in a little bit, but one of the things I was struggling with was trying to see CON laws from the perspective of the people that are proponents of CON laws, and I really struggled with that, because most folks understand the supply and demand aspect of this, right? And as near as I could trace it, that looks like we're talking. We're back on the right track. Okay. Yeah, sorry, I haven't. You can tell as a management consultant a few years ago, because that whole aspect ratio thing is old school. So thank you very much, appreciate it. So the first slide, everybody can read that, right?
Yeah.
All right, this is done for effect on it. Michigan's middle of the road on CON laws. And I just want to point out, Senator Albers, that Georgia's sitting right up on the top. Yeah. So as one of the most restrictive CON states. But this is back in 2005. This is done by Citizens Research Council, and kind of highlights all those dots, all those columns across there are the number of things that are restricted by CON laws. And they essentially measure the severity of those restrictions. And Michigan's about the middle of the road, but we still have some challenges around that. And I just want to kind of highlight a little bit of a legislative timeline for how this kind of, for lack of a better term, metastasized into our healthcare system inside of Michigan. And frankly, I believe it kind of started back a little bit earlier than this timeline suggests. I think it started back in the 1960s with the Great Society. As soon as the government started getting into Medicaid and Medicare and started being responsible for health management and converting insurance from risk management into health management, all of a sudden they started acting like they were the consumer. And so when I was trying to understand why would people be pushing for this CON, it came to the conclusion that, well, they want to be the front row and center in regards to those healthcare decisions, because they're the ones that are on the hook now for the taxpayers, representing the taxpayers. They're the ones actually paying for it. And so if I'm in a big business and I'm going off and I've got a huge supplier network, and I've got the cost of putting together a purchasing department that's got to reach out to 50,000 suppliers versus maybe 5 or 10 tier 1 suppliers, I can cut the cost of my purchasing department by going off and restricting it. So that's about as far as I'm going to go with the proponents of CON. We tried to meet them halfway. The rest of it doesn't hold water. But I think that's where they're coming from. So in Michigan, you know, in the wake of the push for the Great Society in 1972, we adopted CON laws in the state of Michigan. At first, it was just very simple. It was just about hospitals, and it wasn't even hospital beds. Then it went on in 1978, and they expanded it into long-term care facilities and nursing homes. Then in 1988, they started talking about expanded services that they had already done in between 78 and 88, but they did it via regulatory bodies. They didn't do it via statute. Well, they started putting it in the statute in 1988. And in 2002, they got even more creative, and they started going off and starting to talk about different capital thresholds that we should start restricting. And what you see is kind of this progress from freedom, like back in the 60s, and to more and more control, culminating in the Affordable Care Act, which I call control, not care. In 2012, this is where I started getting into the picture in regards to CON. I was a state senator, well, I still am a state senator. I was in my first term, and I didn't even know we had something called Certificate of Need, to be truthful. My wife's a pediatrician, something that never came up in lunch or dinner time conversations. And more I found out about it, I'm going, what the heck are we doing this here in the state of Michigan? And so there was a bill that came up, and it was ostensibly pitched as a reform bill, and we're going to get into that in a little bit, and we'll talk about it, but it was kind of a bit of a wolf in sheep's clothing, and I got involved in the process on it, and I said, you know, this is something we shouldn't have any of this in, and I actually implemented an amendment or proposed an amendment that would have actually repealed CON law in the state of Michigan. And we're going to go into some of the key aspects of that bill and what the impact of it was. But suffice to say, from 2012 to present day, we haven't done anything on CON. And I think they were testing the waters on our new legislature back in 2012. And I think they got their answer. So flash forward here just a little bit. There we go. I wanted to go off and try to address kind of what the impact of CON laws has been in the state of Michigan, and this is just one attempt, and I fully realize that correlation does not denote causation, so I'm not in that, but I wanted to highlight that the top line that we're looking at on that on these charts is the percentage of GDP for healthcare spending in the state of Michigan. And I wanted to highlight that there were several CON reform. When CON was originally passed, we started up on this upward trend where healthcare becomes more and more expensive as a part of overall GDP. And it didn't restrict costs. It didn't lower the costs. It actually kept on climbing. And so it's about as far as I can say with any sort of certainty. There is some sort of correlation, but I cannot say causation. Our CON scope, I won't go into the details of that. Suffice to say, remember, it started off with hospitals, and it's metastasized into pretty much everything else dealing with healthcare. And just to kind of give people an insight into the mechanics of CON, it's all done by region. And so they determine by region where you can have a certain number of beds, where you can have a certain number of MRI machines. If you look up on the top, it's the Upper Peninsula of Michigan. It's about an 8-hour drive from the left side to the right side, and that's all in the same Certificate of Need region. There is no subspecialty. However, City of Detroit, that little black splotch there down by the base of the thumb, they had a special dedicated carve-out in some of our legislation. In particular, it was designed so that they could take advantage of, if you start off with a hospital in Detroit, you could expand into the suburbs because they wanted to go off and get some money to go off and pay for some of the uncompensated care. We're not going to go into the process here in detail. Suffice it to say, it's amazing. If I were to look at this from a free market perspective and say, hey, I want to open up a lemonade stand, and this is the process I have to go through to open up a lemonade stand, I would never open up a lemonade stand. Enough said. So legislative process here. Yeah. So unfortunately, I've gotten very cynical over the last 6 years since I've been in the legislature. My background is aerospace engineering, so the idea that I'm serving in the Senate is kind of a joke to some. But one of the things that gets very frustrating are people that pitch a bill that they say it does one thing, but when you actually read the bill, thank you, Nancy Pelosi, I don't follow your advice, you actually find out it has something else in it, and there's another modification. And Rush Limbaugh used to always say, and always does say, follow the money. And it's important to follow the money on this. Why would somebody propose a bill to do something, and it's always sponsored by somebody in the background? So there was a Senate Bill 1269. That's the bill I was talking about that was offered in 2012. And here's what the analysis said. It's just talking about rearranging the deck chairs on the Titanic, essentially, and just changing around the commission membership. And this is the analysis. This is all it talked about. Here's what the actual details of the bill actually had. And there was a provision specifically talking about what would happen and how they restricted the CON requirements so it would exclude a certain area. And you see this all the time in legislation popping up. And it's blatantly unconstitutional. When you actually look at our Constitution, it says that you're supposed to have a 2/3 vote for any provision that would locate or benefit a specific location. And I think you see the word locate at least 3 times in this. But this is what was pushed. This was what for one particular hospital system that wanted one specific carve-out in the CON law, and it becomes crony capitalism and is far away from free market healthcare as we can get. So that was my first exposure. So I actually introduced an amendment using this bill as a vehicle to repeal CON altogether. I said, well, apparently these folks here that are sponsoring the bill really are interested in getting rid of the restrictions around CON. Well, I feel like we should help them. And so I introduced an amendment. I thought it would be a simple, like, 2-word amendment, repeal CON. It turned out to be an 18-page amendment because CON metastasized into a lot of other aspects of Michigan compiled law. It gets into a lot of other areas of insurance legislation. It gets into a lot of, we have schedules of fees, for example, in a lot of different areas that are based on some of the restrictions that are in here. And it was quite enlightening to see that something that should have been as simple as saying, hey, you know that free market thing? It's worked for 200 years. Let's give it a shot. They decided to they were shied away. So the whole idea that somebody had the audacity to add an amendment on this has spooked them, and it's been quiet ever since. So I'm just going to close with a couple of observations. It really is simply a protectionist policy designed to pick winners and losers in the marketplace. We all know less competition results in higher costs and typically lower quality. The providers are the ones who actually benefit financially from the CON. Whenever you artificially control supply, you're going to have increased costs. And the consumers are the ones that would benefit from CON removal. And I just want to make a little side note. One of the gentlemen that came in here just a few minutes early is a good friend of mine. His name is Gene Yerkew, and his sister is actually the health minister of Ukraine. She's an American. She was out there serving during the conflict with Russia, and they saw her selfless service, and they promoted her to health minister. What's ironic is that we in the United States have gone to the Soviet system of healthcare. The folks in the Ukraine are coming back to what we used to have. So on that note, we can just think about that for a little bit, shall we? Thank you very much, everybody.